And where are we going now, darling?
We're going to talk bottoms.
Okay. Lovely, right.
We've got Dr. Hamza. He should be on one of your lines.
He is. He's flashing on line 2. Are you there, Dr. Hamza?
Yeah, I'm here.
Sorry.
I'm here.
Oh, hi, Dr. Hamza. Sorry, you're not flashing. Line 2 is flashing on my screen. We're very new at this.
You've got an incredible telephone if you can see him flashing from there.
Hi. So, Dr. Hamza, you're going to talk to us about Brazilians or Brazilian bottom lifts.
Not Brazilians and their bottoms.
I think I'll leave you in Steph's capable hands for this one.
I'd be very quiet. Good afternoon, sir.
Yeah.
How are you?
Good afternoon. Fine. Everything is fine. Thank you very much.
Wonderful to hear from you. Please, would you tell me what a Brazilian bottom lift is?
The Brazilian bottom lift is a kind of remodeling of the buttocks, like the Brazilian ethnicity. So the technique is about just remodeling around the buttocks by taking the fat from some areas and adding to the bottom.
Oh, my lord, so it's redistribution.
Exactly. It's a kind of redistribution of the fat. You know, with age, sometimes the butt sags a little bit. So to give them a nice projection, a nice contour, because also with aging, the fat is not well distributed around the body.
I don't know what you're talking about.
Yeah, so we take the fat from the tummy, the waist, and add it to the buttocks. And like that, we give a nice curve. And we call it the Brazilian butt lift because it's a kind of the curve with ethnicity of the Brazilian woman, yeah. This is why we call it like that, yeah.
What's the origin of this, then? Who decided that it was a really good idea to suck fat out of a stomach and shove it in your bottom?
This came with liposuction technique. You know, the liposuction technique is improving all the time. And now recently we are treating the fat. So all the fat that we take from the liposuction, we are trying to add it to many other areas like the breast or some parts of the body. And this idea came after that we had many problems with adding implants to the buttocks. So we decided to move more from the implants to the buttocks to use the fat of the patient. And with the evolving of how we collect the fat and how we make the cell fat lives longer on the body. So this is why this technique is increasing.
I can't help but feel that Mother Nature decided that the fat on your stomach was meant to be there, and if she'd wanted it to be on your bottom, it would have been there. I just feel that there's something a bit strange that we're sort of messing with the original design.
It's not a messing of the original design. It's just because, you know, with age and with the way of life that we have, fat is stored in some places in our body. And as you said, Mother Nature, so the place where the fat is stored mostly in women is the waist, you know, because this is the good fat. It's like that. And because the fat cells are mostly there. So, and with age also we have the fat of the buttocks is reducing, especially if the person is not doing a lot of sport and especially if there is no high muscular tonicity on the buttocks. So it's this procedure is just reshifting and replacing the fat from one area to others to give a nice curve that is lost with age or lost with the way of life.
Okay, and I expect it's probably safer and healthier, as you say, because the implants, we were having issues with that. So your body's not going to reject your own fat, is it? It's going to reabsorb itself.
Exactly.
But what happens if it wants to go back home?
No, this is the condition. If we do this procedure, we need to avoid sitting on the buttocks just after this procedure like that. It's fat cells, so these cells are living, it's living cells. So we need to avoid compression of these cells, and for that, we need to avoid really sitting on the butt if it's possible for at least 1 week, 2 weeks, depending of the procedure. But it's not a big issue because you can lie on the tummy, but avoid especially long sitting on the butts like that. We keep these fat cells living there, and we don't have a high rate of resorption like that. We have a nice result after. And for this procedure, we have many ranges. So we have just giving a nice shape, nice contouring, and sometimes we have some patients that are asking just for getting a big bug. So, and for that, the consultation is very important, and to discuss with the patient, to see her expectation, and to tell her what is possible and what is not possible. So this is the medical aspect of this procedure, yeah.
Okay, Dr. Hamza, I don't know if you're aware of the problem
Yes.
that you are creating for
Ooh, be
men
careful.
in this world. I'll tell you why. Because now,
Why?
if a woman
Yeah.
says to you, does my bum look big in this? I'm not going to know whether yes
wants
is
it.
the right answer or no is the right answer. So I'm just going to have to go, how do I reply now to someone who I don't know who's had a bum lift? Do I say, maybe, what do you want it to look like? It looks exactly how you want it to look.
I'd just say it looks great.
Okay, so why don't we send you off for a bum lift?
I'm not having a bloody bottom. Are you telling me I've got a flat bottom?
No, I love your bottom. I'm just seeing whether you'd be brave enough to give it a test.
So how much does a flat bottom,
a fat
bottom cost
flat
me?
Or fat? I suppose you're probably doing both surgeries, taking it out and putting it in.
Yes, that's why it's genius.
Exactly.
Oh.
Exactly.
Can you take it out of one? Can you have a fat buttock and a flat buttock?
Oh, for goodness'
What would you call that?
Go away.
If you've got a lopsided chair. Dr. Hans, I'd just like you to do the right cheek, if you don't mind, because it's slightly... Now, there's actually a very good point, because we all know you've got an earlobe lower, higher, and one of the breasts is slightly larger than the other one. Is a buttock one buttock slightly larger than the other buttock?
It's difficult. It's not like the breast. Yes, it's This is questions raised in the consultation, and even sometimes when we add the fat. So sometimes the patient asks me if the fat is reduction in one side, it's bigger than the other side. This not happening because the amount that we inject is symmetric, and the fat in that area has a good rate of taking there. So it's not like for the breast, for example, and as we remodel the whole shape, because it's not only about injecting the fat, it's always also about remodeling all the areas around the buttocks, which help the buttock to be lifted also, because if we take the fat from the waist and the lower back, so we have this kind of lifting of all the skin on the buttock area.
Yes,
now
so
it's a kind of bit different, yeah.
How much does something like that cost me?
The cost for this procedure starts from £7,000 and
Shut up.
Darling, your bum
yes, it's a surgery.
looks perfectly big enough in that.
I am astounded that anybody wants a large bottom.
Well, that's
it's a fashion.
Times,
it's a fashion.
It's changing, isn't it?
Really? I mean, you look at Kim Kardashian.
Yeah.
I mean, that's just excessive. I mean, she must have borrowed fat from someone else.
No, we cannot do that. No, we cannot take the fat from someone else. It's your own fat that we need to take, yeah.
Are you sure? But I mean, if you can have someone else's kidney or someone else's heart, why can't you have someone else's fat?
I could sell my own fat.
Buttocks, get your buttocks here.
Three for £1.
One buttock 50. Two tits a pound.
We cannot do that. Maybe within the next year, yes, this will be the evolution of this procedure, yeah.
Oh dear me. Good Lord, you've got him going, Dr. Hans. I'm really sorry about that. He's got a bit flushed in the face. So how many of these do you think you do a month?
How many of these? Depending. So actually, this procedure is mostly associated to the liposuction. So we do, maybe between 10 and 15 cases a month about this procedure.
Wow.
Yeah.
And do you do body contouring as well?
Yes, exactly. I do body contouring with a liposuction. Yeah.
So basically, all you're pretty much doing is hoovering people.
It's remodeling the shape of the body and getting removing from some area, adding to other areas. And actually, what is the procedure also, which is gaining in popularity, is the fat transfer to the breast for breast augmentation instead of using the implant.
So it's going more organic.
Not all cases, yeah.
Okay.
Yes.
And are you married, Dr. Hamza?
Yes, I'm married. And,
okay.
Yeah.
And if it's not too indelicate to ask, has your wife had any of these procedures?
At the moment, no.
And why is that, Dr. Hamza?
She's fine like that, so she's very happy with her body. So I will not insist to ask her to do something that, this kind of request has to be, when someone asks come to me and ask me and explain to him the surgery. So if the person is happy with her body, so I cannot tell her you need to do that or you have to do that. Or
Well, I
so
suspect if you did, you wouldn't be married anymore.
And also, is it unethical to hoover out your own wife's bum or hoover in your own wife's bum?
It's yes. It's for me. Yes. Even if I need to do something to my wife, I prefer that another colleague does. Yes. Even yes, for my wife or for my kids or for anything like that. So I prefer not to touch my own.
You don't like touching your own wife? Well, we've got a real problem here, you know.
I think
I totally understand.
No, it's not like that. No, I understand. It's something. It's yes. I prefer that. Yes.
You want someone else to fiddle with your wife's bum if that's what she wants.
There are websites for things like that, you know.
I know, and I totally understand. I think that's absolutely the right thing.
Will you come back and tell me more? Because I'm fascinated by all of this. I want to know what the trends are and what people are. Because obviously I'm a lady of a certain age, and you've put me off the bum lift, that's for sure. But I think the hoovering of my fat is quite tempting, because it's probably cheaper than a gym membership, I reckon.
It's not, it's not only because we get rid of the gym or we get rid. It's just like other things that may help reshaping the body where the gym or the diet are not possible to do anything. Yeah.
Well, I'm allergic to exercise. I get very breathless, and it's not good for my health. And actually, I can't be bothered. So actually, this is a really good thing for me.
No,
really good.
It's not.
Okay.
It's very not. Your bum looks perfect. It's not too big, it's not too small, it's not too round, it's not too square.
Yeah, and you're just too tight.
And it's not too tight either.
Dr. Hamza, thank you so much for coming and playing along.
Thank you.
We'll speak to you again, I hope. Have a great day. Thank you.